By switching to e-cigarettes, are smokers just maintaining their addiction?
Well, e-cigarettes are a substitution option for people that used to smoke. So switching to vaping is a much safer way of consuming the drug, which is nicotine. Nicotine in and of itself isn't a particularly harmful drug to consume. It's been likened to addiction to caffeine. So if you're a regular coffee drinker, you may find that you need to keep drinking coffee, otherwise you would suffer withdrawal and you would have a headache and feel unwell perhaps for a couple of days. And nicotine is similar. Nicotine as a drug is a stimulant, so it causes a slight increase in heart rate. For most people that's completely safe, but clearly if you were someone that was at high risk of cardiovascular problems, you wouldn't want to be consuming a stimulant drug that might increase your heart rate and may possibly put you at risk of, having a heart attack. But for most people, of course, that's not a problem. So the research that we are undertaking at the moment seems to be finding that people find switching to vaping an easier way of stopping smoking than ways that they've tried in the past. So although there is some level of maintenance to addiction to nicotine, it offers a safer alternative and also is attractive to people in that they are able to continue in their social groups and continue in the rituals that they enjoyed about smoking, so getting a break from their daily lives, enjoying the hand-to-mouth behavioural action that they used to enjoy when they were a smoker.
People in our research are concerned that they're vaping more frequently than they used to smoke cigarettes. Is this a problem?
Well, our ongoing research is certainly finding that people seem to report vaping sometimes in much different patterns to how they used to smoke. So people tell us that they vape more frequently, they graze and tend to vape little and often, whereas when they were smokers, they might smoke a certain number of cigarettes a day and would smoke the whole cigarette and then have a break until the next cigarette. We do know from emergent research that actually the patterns of vaping are adaptive at helping people to maintain their level of blood nicotine. So smokers would experience highs and lows in terms of their blood nicotine levels. The blood nicotine level goes up very high when you have a cigarette and then dips down low between times of not smoking. What is quite important to note is that if there are any potential harms of vaping due to the flavourings that are added to the e-liquid, then it may be something to consider to use a higher dose of nicotine and to vape less often in order to maintain your nicotine levels, rather than to try and use a lower dose of nicotine and find that you're actually vaping much more frequently.
How hard is it to give up vaping?
Well, we don't really know the answer to that question. What we're finding in our ongoing research is we've got a number of examples of people who've managed to stop smoking through using an e-cigarette and then have gone on to successfully stop vaping as well. It's really a matter of personal choice. Being addicted to nicotine through vaping in and of itself is not particularly harmful to health, but if it's something that you're not comfortable with or that others around you are not comfortable with, then you may want to consider stopping. Obviously, the best thing to maintain a healthy lifestyle is not to be consuming any addictive substance, so you may want to stop vaping and you may want to look at your other patterns of health behaviours.
How can vapers get involved in research?
Well, we really want to hear the views of people that have given up smoking by vaping, whether or not they find that they've gone back to smoking. So you can look at our website, which is ecigresearch.uea.ac.uk. There's an online survey that you could complete, and we'd really like to hear from you.